My name is Sarah, and I'm a pharmacist with Jack Health. Today, I'm going to talk to you about the medication Saxenda. I'm going to explain to you how it works, how you use the medication, what side effects to look out for, and some general tips and tricks when taking this medication. So, what is Saxenda used for? Saxenda is a weight loss medication that regulates something called GLP-1. What GLP-1 does in the body is regulate your appetite and fullness signals in your stomach. This medication was originally used for diabetes control, so oftentimes people report improvement in their blood sugar and other diabetes markers. It can also help overall with lowering your blood pressure and your cholesterol due to loss of weight. This medication works by reducing hunger, increasing meal fullness, and decreasing the rate of stomach emptying after a meal. How do you use Saxenda? Well, Saxenda is an injectable medication that comes in a pen like this. It's a once daily injection, and you can inject yourself in the stomach, in the upper thigh, or in the back of the arm. It's always helpful to have somebody teach you how to use this medication, which is what I'm going to do today. But you can also have a family member or partner help you inject the medication if you're not comfortable doing it yourself. Reminder, this medication is not suitable for people who are pregnant and breastfeeding. We'll start with instructions on how to prepare the pen. You want to first pull off the pen cap and look at the medication in the vial in the pen. You want the medication to be clear and not cloudy. If the medication is cloudy, do not use it and throw away the pen. You can contact your medical provider for more information, and we can also contact the company for a replacement pen if there's any issues with the medication. Because this medication requires an injection, you will need some needles. The needles that we use for this medication are very small. They're less than 1/2 centimeter long, and they're injected into the subcutaneous layer of skin. So what that means is under your skin, you have a layer of fat that's called your subcutaneous layer. It's kind of like a protective layer between your bones, your muscles, and the skin. The medication gets injected into this area, pinch the skin so that you can see the area better. The first time you use a new pen, you should always check the flow. Checking the flow means that there's no blockage in the needle tip as well as in the pen tip itself. So to check the flow, you're going to put the needle onto the end of the syringe, onto the end of the pen. The needle comes with 2 caps. A large cap and a small cap, as well as a paper tab to open the needle. This is to keep the needle sterile and also to protect your fingers when you're putting the needle onto the pen. So, the first thing you're going to do is pull back the paper tab and then screw the needle onto the pen tip. Then you want to remove the large outer cap and save it for later. We're going to use this to cover the needle after we use the medication. Then we want to take off the smaller cap on the needle and throw it away. Now your needle is exposed. Be very careful with handling a pen with an exposed needle. You do not want to injure yourself or anyone else. To check the flow, you want to turn the dial until you see the 3 line and the 3 dots. This is the flow checker. You want to hold the pen upright, needle facing up, and then press the button. You should see a small drop of medication up here at the end of the needle. If it does not, you can try this process again up to 6 times. You can also try replacing the needle because it may be a blockage in the needle. Once you have checked the flow, you're going to want to select the dose. So you're going to turn it until you see the number up here that you want for your first dose. So when you're first starting out using the medication, you're going to start with a dose of 0.6 milligrams. So just turn the dial until you hit 0.6. You should always use the dose window and check the number that shows up in it. You want to use that, not the number of clicks of the pen, because the pen just clicks differently depending on how you turn it. Your medication is ready to inject. To inject the medication, you want to pierce the skin with the needle. It's a good idea to clean the area that you're going to inject, just to make sure that you don't introduce any bacteria into your system. So I would suggest just washing the area and drying it thoroughly, or you can use an alcohol swab to clean the area. Once the area is clean, you can have somebody pinch the area just so it's a little bit easier to inject into. That helps a little bit if it's on the stomach. But on the arm, it should be okay just to inject directly. I'm going to use this one without a needle to pretend inject myself. So I've picked the dose I'm ready to inject. And what you're going to do is pierce the skin with the needle and press down on the button. Once you press down to deliver the dose, you want to hold it for 6 seconds. 1, 2, 3, 4, 5, 6. And then you can remove the needle from the skin. Just pull it straight out the way you put it in. After that, you can cap the needle with the large cap that we did not discard. So what you can do is just put the cap on the table and slide the needle into the cap to close it. And then once it's covered, you can twist off the needle and throw it out. You can grab a sharp spin from any local pharmacy, and what that is just a spin where you can put needles and then dispose of them safely. Most pharmacies carry sharp spins, and most of them will take them back when they're full. There's some very important tips to be aware of when you're using this medication. If you remove the needle tip before the 6 seconds is up, you may not get the full dose of medication. So you want to be a little patient. Never reuse a needle because you're at risk of contamination with bacteria. As well, it will blunt the tip, which will make the injection more painful. Finally, always be careful when covering the needle once you're done injecting. You want to be careful when handling any needles to avoid any injuries. The dosing for Saxenda is a titration. What a titration is starting at a lower dose and slowly increasing the dose over time until you hit a maintenance dose for the medication. This maintenance dose is usually the most effective dose, but we use a titration to reduce the amount of side effects you feel and slowly get you used to the medication. The typical starting dose for Saxenda is 0.6 milligrams once a day. After 1 week, you can increase this dose to 1.2 milligrams, and then on week 3, the dose is 1.8. Week 4, the dose is 2.4 milligrams, and then finally on week 5, you'll hit the maintenance dose of 3 milligrams. If you're having a lot of side effects with one of the lower doses, it's best to maintain that dose for a while, 1 or 2 weeks, until you feel comfortable increasing the dose again. You can always let your healthcare practitioner know if you're having any difficulties with the dose that you're on, and they can work with you to find a dose that works better for you. The most common side effects with Saxenda are upset stomach and nausea. These are most common during the first few weeks of using the medication, but if you stick with taking the medication for more than 2 months, you'll find that these side effects will subside or become less difficult to deal with. It can help to have smaller or bland meals during this time to help with those feelings of nausea. It is also important to stay hydrated while you're taking this medication. Some other side effects that you may experience include diarrhea or constipation. Listen, some people have one, some people have the other, and some people will have both. Tiredness or dizziness. In some cases, especially if you have diabetes or prediabetes, you may experience low blood sugar. When you have low blood sugar, you may feel dizzy, sweaty, or nauseous, and anxiety. And this all comes at once. To treat low blood sugar, you want to just have something with sugar in it. Ideally, you want something that has quick digesting carbs. That means sugar in its most pure form. So you can have a tablespoon of sugar mixed in water, or a tablespoon of honey, or 2/3 of a juice box, or some candy. 6 Lifesavers or 2 of the Rocket candies is usually good enough. If you do test your blood sugar, you can also test your blood sugar after having a hypoglycemic or low blood sugar episode. You want your sugar level to be more than 4. And if you're not going to have a meal in the next hour or so, you should have a snack, like some crackers and some cheese. This will help regulate your blood sugar and make you feel a little bit less nauseous. Now, low blood sugar is not a super common side effect, but it can happen, especially if you're not eating very frequently. So it's always good to make sure that you're going to eat before doing any unusual or vigorous activity, like going to the gym or going for a very long walk or hike. All medications have serious side effects as well. That would include allergic reactions like a tightening in the throat, swelling of the face, and itchiness, severe pain in the stomach area that does not go away, fever, or any other serious health concerns. If you have any serious health concerns with this medication, you should stop taking it right away. And if it's an emergency situation like an allergic reaction, you should go see a healthcare professional in an emergency room right away. This medication has been studied to take to up to a year continuously to lose and maintain your weight and maintain weight loss. In the clinical trials, patients lost an average of 5 to 10% of body weight. However, that's just an average. You can lose more weight than this, especially if you incorporate dietary and physical activity changes into your life. Any behavioral lifestyle improvements will improve your rate of weight loss as well as maintaining the weight you have lost. If you have any further questions about how to use the medication or would like to chat about your medication, side effects, or anything else, you can use your My Health Medical Chat to chat with one of our providers. I hope this video is helpful, and thanks for watching.